How does a pulmonologist test lung function? In recent days, lung health has become a hot topic, especially with rising concerns about respiratory illnesses. Many people are asking, how does a pulmonologist test lung function? If you are curious about how these specialists assess lung health, you are in the right place. Pulmonologists use several tests to evaluate how well your lungs are functioning. The most common test is called spirometry. This test measures how much air you can inhale and exhale, and how quickly air moves out of your lungs. It helps identify any airway obstruction or restriction. Another important test is body plethysmography. In this test, you sit in a sealed booth. It measures lung volumes, including total lung capacity and residual volume, which spirometry cannot measure. Next, there is the diffusing capacity test. This test checks how effectively oxygen passes from your lungs into your bloodstream. It is essential for detecting diseases that impact lung tissue or blood vessels. Pulmonologists also perform bronchodilator reversibility testing. After the initial spirometry, you inhale a bronchodilator medication. Then, they repeat spirometry to see if airflow improves. This is crucial for determining if airway obstruction is reversible, as seen in asthma cases. The exhaled nitric oxide test is another useful tool. It measures nitric oxide levels in your breath, which helps in diagnosing and managing asthma by indicating airway inflammation. Impulse oscillometry is a newer method that measures lung function without requiring forced breathing. It assesses airway resistance and reactance during normal breathing, making it highly precise. Additionally, the cardiopulmonary exercise test evaluates how your heart and lungs respond during physical activity. It is useful for assessing exercise tolerance and unexplained breathlessness. Lung ultrasonography can also be used for detecting certain lung conditions, such as pneumothorax, more sensitively than chest X-rays. However, it is less common for routine lung function testing. After conducting these tests, pulmonologists interpret the results to diagnose conditions like chronic obstructive pulmonary disease, asthma, or restrictive lung diseases. They then discuss treatment options or further evaluations with you. Understanding how these tests work can empower you to take charge of your lung health.